I'm Sarah Boy-Smith and I work at the Diagnostic Centre in Exning, and I investigate lame or poorly performing horses. And I thought I would chat to you today about that process and what might happen if you had to bring your horse to the hospital for an investigation. So first of all, we'll chat to you about the history of the horse. So we'll need to do a general history, age, breed, what you use the horse for, etc. But more specifically, we need to do a more detailed history about the actual problem that you've got. Which leg is lame? How lame is he or she? How long has it been going on for? Is it getting better or worse? Is it worse on the left rein or the right rein? Is your horse better at trot or at canter, or is canter worse than trot? And is your horse struggling with any particular movement, such as half pass or shoulder in? All these questions and answers give us a much more detailed appreciation of what might be happening with your horse. The next stage is the clinical examination, where we need to get hands-on and look at your horse. So we're going to do a detailed examination of the musculoskeletal system. So we need to look at your horse from afar, with your horse standing nice and square in front and nice and square behind. And this allows us to look at the conformation and any obvious asymmetries that your horse might have. We then need to have a good feel of those legs. So we feel the front legs, the hind legs, compare left fore to right fore and left hind to right hind. And we want to feel all the major joints, tendons, ligaments, and see whether we can pick up any heat, swelling, pain on palpation. It's really important to flex the joints to see whether there is a normal range of motion and to see whether there's any associated pain. It's important, obviously, again, to look at the axial skeleton or the neck, back, pelvic region. Again, to look for normal flexibility and any obvious atrophy of the musculature that might be there. So atrophy is when you have a muscle loss due to a disuse of that area. So for example, if your horse is lame on the left hind leg, then the left gluteal musculature or the sort of bum cheek musculature is not going to potentially be as built up as the right hind because they're not using that left hind as much as the right hind. It's important again to look for any muscular tension, muscular pain that we might be feeling along that neck, back, pelvic region, and obviously down the top part of the forelimbs and of the hind limbs as well. It's a good idea to look at the facial expression while we're doing this. So some horses will just tense their jaw muscles or flicker their eyelids or put their ears back if they feel something is a little bit more painful than it should be.